Hello, dear colleagues. Today I want to discuss with you the new series of webinars that became available recently on OHI-S platform. And I can tell that finally it's available on their website, because for many years I was hoping that it would be possible to get acquainted with the works of Mariano Rocabado in online webinars or offline recorded webinars as it is available right now. And Mariano Rocabado and his team, prosthodontist Dr. Roberto Gutierrez and young doctor, but very talented Dr. Fernando Gutierrez, they are working as a team in Santiago, in Chile, and they show very effective, very good results in treatment of the patients with complex situations. And I don't think that Mariano Rocabado needs to be, presented to anybody. I think everybody knows him, uh, and I think he's the most well-known non-dentist in the dental world. Mariano Rocabado is a physical therapist, manual therapist who is working closely with a dentist, for dentists, and he's traveling around the world giving education about the functional approach to the dental rehabilitation and about the collaboration, the fruitful collaboration with a physical therapist. So I think that everybody knows him, but maybe not everybody thinks that this knowledge is in great demand for every dentist. But I think that every dentist, everyone who's working with occlusion, I mean, prosthodontist, implantologist, orthodontists, even those who are doing restorations, they need to see these webinars. They need to get acquainted with this knowledge. Because, for many years, even now, we dentists tend to think about TMJ from the point of view of the lower jaw. So when we say or we think TMJ, we always imagine the condyle and the disc and the position of the lower jaw and how it is related with each other. But very often we tend to forget the other part of the joint, which is the glenoid fossa and the eminence. And glenoid fossa and the eminence, or as Dr. Mariano Rocabado sometimes call it, the temporal tubercle or temporary condyle, is the part of the temporal bone, and temporal bone is a part of the skull, and position of the skull, position of the head is directly dependent from the cervical spine. So we have here the relationship between the problems with the cervical spine, with occiput, with atlas, with axis, with the curvature of the cervical spine, that would influence the position of the lower jaw. And sometimes when, for example, if you're orthodontist and you struggle with correction of the class 2 and you use class 2 elastics, and you see that on one side you manage to get very good class 1 relationship on canines, but on another side, no matter what you're doing, no matter how big is the force you're applying, you either get the relapse of the class 2 relationship, or you see that the canine is worn out and you lose the cusp of the canine during the movement of the lower jaw. And you think that maybe it's something you are doing that is not effective, not correct, and you try to change your strategy. But it can be that the reason is not in the lower jaw, reason is not in the direct relationship between maxilla and mandible. Maybe the reason is that one of the cervical spine's vertebrae, for example, atlas or axis, is rotated, and it will influence the position of the occiput, and it will influence the position of the skull, and it will influence the position of the glenoid fossa. And that will lead to the cant of occlusion and the maybe not correct or some kind of forced position of the lower jaw. And no matter what you do on a dental level, until you will be able to correct the cervical spine issues, you will not have good, successful orthodontic result of your treatment. Or, for example, you're doing the prosthodontic rehabilitation, you're doing the restorations in case of the worn out dentition, and then you see that maybe on one side, on both sides, you see a lot of chipping, a lot of problems with your restorations, maybe the fracture, maybe the indications for the constant replacement of the direct restorations, or you see maybe recessions or whatsoever. You also think maybe it's a dental reason, maybe it's parafunction, bruxism, habits, whatsoever. But it can be that we are dealing with a forced position of the lower jaw, once again, that is directly related to the cervical spine issues. So what Dr. Rocabado is giving to you during this course is the dynamic functional anatomy of the synovial temporomandibular joint. And also he gives you the relationship between the cervical spine and the TMJ and occlusion. What he is calling the tricentric concept, where we're talking about the physiologic occlusion, the functional physiologic position of the TMJ structures, and not only condyle and the disc, but also talking about the glenoid fossa, the eminence, and the capsule and the ligaments of the TMJ, and the cervical spine, the first and second cervical vertebrae, the atlas, the axis, the curvature of the cervical spine, the natural lordosis or the straightening of the curvature, or even the reverse curvature, which we call kyphosis, the relationship of the cervical spine to the position of the skull, and influence of the skull, the head position, to the position of the glenoid fossa and the eminence. So how you can diagnose all these three aspects and combine them together in this tricentric concept, and how you can use this knowledge in order to make the treatment plan, and not just a treatment plan, but to make the interdisciplinary treatment plan, where the prosthodontist or the orthodontist, having this knowledge from Mariano Rocabado courses, can make a very nice high quality diagnostics and can see and diagnose these problems that are going beyond the dental occlusion, going beyond the oral cavity, and he can then refer the patient to the physical therapist, to the manual therapist, but not just refer him to be treated from some disease, but refer him with a strict order what have to be done. So there is a good communication, because the way the course is constructed, that Mariano Rocabado and Dr. Gutierrez teach physical therapists, manual therapists, how to read occlusion, how to understand occlusion, how to make sure that you will understand some dental problems, and at the same time they teach dentists how to read the cervical spine, how to understand the cervical spine issues using the same methods of diagnostics that we used in dentistry for many years. I mean, the cephalogram, cephalometric analysis, and the being computer tomography and MRI. So using all these methods, radiologic method, the examination method, also knowing about muscles, about occlusion, how you can make the diagnosis of these problems, and then you can refer the patient to the physical therapist, manual therapist, or vice versa, the physical therapist, seeing the problems with occlusion, working with a patient who has problems with his vertebral, with his spine, not only cervical spine, but maybe some posture issues. He can relate the patient to the dentist, saying that also take a look at occlusion. I see some problems there, and we have to work in a team. And it's a fruitful collaboration, because Dr. Gutierrez gives you the protocol in which situation that can be diagnosed with a normal dental procedures, like mounting of the models in the articulator, with the use of the radiologic analysis, with the use of some functional examinations, how you can make the decision what splint to make, how to produce a splint, what is the design of the splint, in order to send the patient to refer him to the physical therapist, where in its order, physical therapist would start working with a patient wearing the splint in the mouth, and he will be working with the correction of the cervical spine issues, with the issues of the muscles, with the skull position, head position, and at the same time, after each appointment from the manual therapist, the patient can go back to the dentist, prosthodontist, orthodontist, who will make the necessary calibration and correction of the splint in order to keep on doing this treatment, as long as also as the patient himself will do some kind of exercises that would be given by the physical therapist, but will be checked always by the dentist, how effective they are and how maybe motivated the patient is in doing them. So, what is the level of compliance from the patient? So, this is a comprehensive course that gives you complete understanding how to perform the diagnostic appointment, data acquisition, what data we need, how we can use this data, what to do with this information, how to process it, and then how to make the diagnosis, and from diagnosis, what would be the treatment options. So Dr. Gutierrez shows a lot of clinical examples of orthodontic treatment and prosthodontic treatment, or the combined orthodontic and prosthodontic treatment, where there was a benefit for the patient to also be treated by the physical therapies during this process, and how we can really achieve the stable functional result and the benefit for the patient. So I think this is a must-see course for the team. So you get it as a team, you watch it, maybe you'll rewatch it again just to make sure that you remembered everything. You can discuss the information, you can discuss the collaboration that could be between each of the members of the team in order to be more effective, and then you can use this knowledge for the benefit of your patients and also to make your practice more efficient and safer, because also it's a matter of responsibility. Because if you working alone without any team and you manage to diagnose the problems with the cervical spine that influence the dental problems, it's a matter either you'll find someone with whom you will work together, you will maybe collaborating, and the patient will be referred to this specialist, or if the patient refuses, or you can find this specialist around you, you will limit your responsibility for the work you're doing for the patient. So I wish to you to have great results after watching this course and really using this knowledge for yourself, for making your practice more successful, and most of all for being able to help all the patients that comes to your practice. So good luck to you, have great results and grateful patients. Goodbye.